Migraines are more than one condition. There can be many different types, and each type should have a video dedicated to its individual effects and treatments. However, in this overview, I'll give you some helpful tips that may be worth trying regardless of what type of migraine that you're experiencing. Some types of migraines are migraines with aura, migraine without an aura, a migraine with a brainstem aura, a vestibular migraine, medication overuse headache, a menstrual migraine, a chronic migraine, an abdominal migraine, a cyclical vomiting syndrome, and other headache disorders. A migraine is a vascular headache, and it's believed to be caused by blood flow changes and certain chemical changes in the brain, leading to a cascade of events, including constriction of the arteries supplying blood to the brain and the release of certain brain chemicals. Although there may be no vasodilation during a migraine attack, vessels may dilate at time points well before the attack, and this may leave a series of signaling events within the vessel in its wake. To further complicate things, according to the vascular theory for migraine attacks are associated with intracranial and extracranial arterial dilation. A recent study using magnetic resonance angiography has suggested that slight dilation of the intracranial arteries may occur during migraine attacks. To help reduce spasms, which can be caused by dilation and constriction, magnesium can be helpful. One study actually found that a regular intake of magnesium reduced the frequency of migraine attacks by 41%. Other research has shown that taking daily magnesium supplements can be effective at preventing menstrual-related migraines. Although magnesium oxide was used in the study, it's cheap and poorly absorbed. For best results, I would recommend magnesium bisglycinate. Start to slowly increase your dose until the side effects of stomach discomfort or diarrhea are noticed. Then gradually reduce your dose until you can determine your maximum daily tolerable amount that doesn't cause any digestive disturbances. As magnesium is required by over 300 processes in the body, it can have profound benefits to health over a few months of supplementation. Zinc supplementation had a beneficial effect on the frequency of migraine attacks in migraine patients. This is understandable, as like magnesium being required by over 300 processes in the body, zinc is also required by around 100 enzyme systems. Therefore, one could assume it would also have a synergistic beneficial effect when taken with magnesium for a few months. Quercetin, which is a bioflavonoid that can be found in elderberry juice or grapefruit peel, helps to increase the absorption of zinc, vitamin C, and shikimic acid. Coenzyme Q10, when taken in the absorbable form ubiquinol. CoQ10 helps to convert nutrients such as fatty acids and carbohydrates into energy-producing adenosine triphosphate, and this helps to fuel energy transfer within the cells. Scientists have found people who experience migraine attacks have lower levels of some nutrients like coenzyme Q10, riboflavin, and magnesium. Doctors typically recommend somewhere between 100 and 200 milligrams of ubiquinol per day, but people with certain medical conditions like migraines and some heart problems may need more than that to stay healthy. The powerful anti-aging substance, which is extracted from red wine or Japanese knotweed, is resveratrol, and this may be a beneficial addition to your diet if you have migraines. Resveratrol, by facilitating the regulation of arterial tone, may suppress active vasomotor changes, which are associated with migraine and help to alleviate symptoms. Typical doses of resveratrol are 500 to 1000 milligrams per day in the form of trans resveratrol. There's limited evidence that curcumin, which is a concentrated turmeric supplement, can help to reduce the frequency and the severity of migraine attacks. There's reason to believe that ginger and turmeric both contain active ingredients that can provide at least some relief to those suffering from a number of painful conditions, from arthritis and gastric discomfort to migraine headaches and post-surgical pain. Typical doses of curcumin can range from 1 to 5 grams per day, but due to its low bioavailability, its absorption needs to be enhanced by taking it with biopterin, which is a black pepper extract, or taking it with a fat like butter, ghee, coconut oil, or fish oil. Fish oil, omega-3. A diet that's rich in omega-3 fatty acids reduces the frequency and the intensity of monthly migraine attacks. This was suggested in a new study. In this international study, a diet high in omega-3 was associated with 2 fewer headache days per month, and a diet high in omega-3 and low in the inflammatory omega-6 cut monthly migraine days by 4. Typical doses of omega-3 are 3 to 9 grams per day of a molecularly distilled EPA DHA fish oil blend. Migraine is a complex disease, and it's a consequence of an interaction between genetics, epigenetics, and environmental factors. The MTHFR gene polymorphism is one of the few replicated genetic risk factors for migraine and encodes an enzyme that's crucial for the folate and the methionine cycles. You can check out my video on the MTHFR polymorphism to learn how to determine if you're an under or an over methylator, and then see which supplements you need to help to control this condition. Sleep, mood, and headaches are all controlled by common regions in your brain. They all use similar chemical brain messengers, so it's no coincidence that sleep problems can trigger migraines. Also, when you don't get enough sleep, your pain threshold gets lower. This means you're more sensitive to things that hurt, including a migraine attack. Anything that keeps you from getting 7 to 8 hours of uninterrupted sleep each night could be a migraine trigger. Check out my video on herbs to help you sleep for more information on this. Melatonin, the sleep hormone. A study published in the journal Headache found that patients with chronic migraines had abnormally low levels of melatonin byproducts in their urine. This supports earlier research that linked low melatonin to migraines. It suggests that taking melatonin supplements may help to prevent or treat migraines. According to the American Headache Society, about 4 out of 5 people with migraines report stress as a trigger. Relaxation following a period of high stress has also been identified as a possible migraine trigger. During stress, cortisol increases, and during the relaxing phase that follows, cortisol levels drop. This fluctuation can trigger the migraine. The herb tulsi, known as holy basil, can be taken as a tea to help to control cortisol. The supplement phosphatidylserine, when taken at doses of 600 to 800 milligrams per day, is also effective at controlling cortisol stress hormone. For your body to produce cortisol, pregnenolone is needed. Look into the pregnenolone steal, where constant stress over a long period of time can use up your pregnenolone stores, and this can then lead to deficiencies in the anti-aging hormones DHEA and the sex hormones estrogen and testosterone. For this reason, many people take the pro-hormone supplement of pregnenolone to help to reduce the chronic effects of stress and also for its potential anti-aging benefits. In recent years, more and more research seems to be focusing on the fact that inflammation may indeed play a major role in the onset of migraine headaches. There's evidence that shows taking anti-inflammatory medications or eating an anti-inflammatory diet can actually reduce the number of migraines that you experience. Check out my video on antioxidants, on inflammation, and on autoimmune diseases for lots of diet and supplement advice to help you here. Vinpocetine is an alkaloid derived from the compound vincamine, which comes from the periwinkle plant. Vinpocetine is often employed to lower inflammation and oxidative stress, both of which help to alleviate migraines. More importantly, vinpocetine is well known for increasing blood flow in the brain. This supplement is often taken to improve memory and focus. Current literature indicates that vitamin D may be beneficial in some patients suffering from headaches, mainly to reduce the frequency of the headaches. You want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency that you may have. Riboflavin plays an important role in cellular energy production in the body. Its role in mitochondrial energy metabolism suggests that it may be effective in migraines. From the evidence available, it's well tolerated and potentially effective as a preventative treatment for migraines. For migraine headaches, the most common dose of riboflavin is 400 milligrams taken daily for at least 3 months. Serotonin is thought to be an underlying neurotransmitter involved in migraine, based on a lower than normal level of serotonin, which increases during the attacks. You can check out my video, Know Your Neurotransmitter, Serotonin, for more information on ways to naturally balance this. Some other herbs that can help migraines are feverfew, butterbur, peppermint, willow, ginger, valerian, and coriander seeds. Some recommend caffeine. However, the after effects of caffeine, being the withdrawals, may increase headaches and worsen symptoms. Vitamin C can also be used as a scavenger of reactive oxygen species for treating neurogenic inflammation in migraine patients. Check out my video on making liposomal vitamin C cheaply at home. This process can also be used to increase the absorption of some of the other migraine treatments, such as resveratrol, curcumin, and glutathione. Serrapeptase is a chemical taken from the silkworm. It's a commonly used drug in Japan and Europe. In the United States, serrapeptase is classified as a dietary supplement. Serrapeptase is used for painful conditions, including back pain, osteoarthritis, rheumatoid arthritis, osteoporosis, fibromyalgia, carpal tunnel syndrome, migraine headaches, and tension headache. It's also used for conditions that involve pain and swelling, which are inflammation, including sinusitis, laryngitis, sore throat, ear infections, swelling after surgery, swelling of a vein with the formation of a blood clot, and inflammatory bowel disease, including ulcerative colitis and Crohn's disease. Some people use serrapeptase for heart disease and for hardening of the arteries. Regular exercise can reduce the frequency and the intensity of headaches and migraines. When one exercises, the body releases endorphins, which are the body's natural painkillers. Exercise reduces stress and helps individuals to sleep at night. Stress and inadequate sleep are two migraine triggers. An example of reactive hypoglycemia is when you eat simple sugars, such as white sugar. This raises blood sugar fast, and then insulin overproduces, causing a rapid decline in blood sugar. Both types of hypoglycemia can result in headaches and migraines. Low blood sugar may cause a general headache or even a migraine also. A low glycemic index diet or a low GI diet would be recommended. You can check out my video on type 1 and type 2 diabetes for ways to improve your blood sugar levels naturally. Glutathione levels were significantly reduced in migraine patients. The best form would be S-acetylglutathione, taken at 200 milligrams per day, along with its precursor being 200 micrograms of selenium once per day, and N-acetylcysteine taken at 500 milligrams 3 times per day. Check out my video on glutathione for more information on the body's most powerful antioxidant.